I'm the head of clinical content with eBroselow, and I'm also a nurse. Today we would like to demonstrate some of the capabilities of eBroselow 4 and how you will use it in your daily practice at your facility. We will do this by going through a few scenarios. Our first scenario is a 70-year-old man who weighs 80 kilograms who has been admitted to the general medical unit with a diagnosis of community-acquired pneumonia. He is also concurrently suffering from congestive heart failure. In an effort to decrease his dyspnea, his overall fluids have been decreased. You receive an order from the physician for erythromycin, 5 milligrams per kilogram, to be administered every 6 hours. We will now demonstrate how you will use eBroselow to administer the medicine.
eBroselow can be used in 3 easy steps. The first step is to select the weight. The weights are presented in zones across the top. This first page shows pediatric zones. To get an adult weight, click on the greater than symbol to see the adult weight zones. This patient is 80 kilograms, so start by picking the adult dosing range. The next step is to select the drug. We will accomplish this by typing the first letters of erythromycin into the search box. Erythromycin requires a more refined weight for adult dosing. This patient is 80 kilograms, so go ahead and pick 75 to 90 kilograms. As soon as you do so, you'll see all of the indications for erythromycin. The third step is to select the indication. As you can see here, erythromycin shows both the oral and the IV indications, as well as the corresponding dose. For this patient, we will select community-acquired pneumonia IV. What results is the eBroselow virtual page for this indication. The eBroselow virtual page is unique in giving you exactly what you need and no more. In a traditional medication reference, you waste time skimming through reams of irrelevant information about erythromycin. In this example, the eBroselow virtual page precisely tells you how to give an 80 kilogram patient erythromycin IV for community-acquired pneumonia. The first text information describes how to prepare and administer the medication. Since this patient is under fluid restrictions due to congestive heart failure, it may be best to prepare the 5 mg per ml concentration as indicated. You can select the 5 mg per ml concentration in the dosing grid. When you click on the concentration, it turns yellow and you have specified the target concentration for mixing. Then, open the mixing tool by selecting Click here for mixing instructions. In following the guidance of the mixing instructions, you would pull up 8.3 mL of the initial concentration of erythromycin, mix it with 74.7 mL of normal saline, and achieve a final volume of 83 mL. You didn't have to calculate the doses or the dilution. eBroselow just took the math out of medicine. Now that the medication is prepared, you continue to read the eBroselow instructions on administering the drug to the patient. The first thing noted is this medication should not be mixed with dextrose fluids. You see that the patient is receiving dextrose due to another medication. eBroselow just prevented giving incompatible solutions in the same IV line. Before leaving the medication preparation room, you take a new set of IV tubing to start a different line for the erythromycin. A quick review of remarks and adverse reactions alerts you that this medication is contraindicated for patients concurrently receiving lovastatin or simvastatin. Due to the patient's cardiac history, you quickly check his medication list and confirm he is not receiving either of those drugs. In addition, the adverse reactions section notes a potential for cardiac side effects. You decide to turn on the cardiac monitor during the infusion to decrease the risk. Since eBroselow recommends using a larger vein for this drug due to an increased risk of phlebitis, you elect to administer the drug through the patient's antecubital IV site, as opposed to the other peripheral IV site in his hand. The IV pump is programmed for 1 hour as instructed, and the patient safely receives the medication without incident. In addition, you save time by not having to sift through pages of mostly irrelevant information from a reference manual. There are a few other features on this virtual page, such as the QR code in the upper right corner, as well as the log, order, and administer buttons in the bottom right corner. We won't review those functions in this video, but they can be seen in a separate tutorial. In summary, how did eBroselow help our patient with pneumonia? First of all, eBroselow quickly notified the nurse and the physician of the availability of a higher concentrated infusion. This decreased his risk for fluid overload and subsequently decreased his shortness of breath. Also, eBroselow showed the nurse that the medication is incompatible with the currently infusing IV fluids. This prevented precipitate in the IV line. eBroselow recommended using a larger vein due to the risk of phlebitis. Following these instructions prevented phlebitis and also decreased patient discomfort. Finally, eBroselow warned of the potential for cardiac side effects. She elected to place the patient on the cardiac monitor during the infusion. This increased patient safety. To compare eBroselow to a traditional medication reference, you must first remember that a regular reference groups everything by the drug. You have to read through paragraphs of irrelevant text to figure out the instructions for a given diagnosis. eBroselow, on the other hand, is organized by not only the drug name, but also by the diagnosis and patient weight. The caregiver thereby sees only what is relevant for that patient. This saves time and prevents errors. In addition, instructions on mixing the medication are not located in the traditional reference. This would have required a phone call to pharmacy or potentially a third reference. And, as always, eBroselow does all the calculations in milliliters, thereby preventing calculation errors. In the past few minutes, I showed you multiple cases where eBroselow saved time and prevented errors compared to a traditional reference. Taken together, with eBroselow, the hypothetical 70-year-old man received treatment much more quickly than normal and was more likely to recover with fewer complications.
Now, to move on to the next scenario, this one involves an infant. Pretend that you are working in the emergency department and a 2-week-old female infant weighing 4 kilos presents with severe respiratory distress and cyanosis. The physician suspects closure of the ductus arteriosus and orders an alprazolam drip to be started immediately. This is how you would use the eBroselow system to mix the medication and administer the drugs.
Upon accessing the eBroselow system, you would again go through the 3 easy steps. First, select the 4 kilogram weight zone. Next, you can search for the alprazolam medication by using the categories on the left side of the page. Clicking on the infusions category will display the drugs. Alprazolam is at the top of the list because they are in alphabetical order. Let's pretend that you initially select the 20 mics per ml concentration. You quickly realize that you meant to select the 10 mic per ml concentration. Fortunately, a section at the bottom of the page contains related links. You click on the 10 mic per ml concentration, bringing up a new virtual page. Upon opening the mixing instructions, you follow the directions to mix 1 ml of the initial concentration of alprazolam with 49 ml of D5W for a final volume of 10 mics per ml. If you wish to change the final volume, you can simply put your cursor in the field and type a new number. The math will again change for you. For continuous infusions such as this, you can also change the initial concentration. Say you have a 100 ml bag and want to make it real simple. Change the starting D5W volume to 100 ml and see how you now add 2 ml of 500 mics per ml alprazolam to get your final solution. Immediately at the top of the virtual page, there are instructions to refine the patient's weight for more exact dosing. This patient actually weighs 4.3 kilograms, so you click on 4.3. As you can see, the dosing grid automatically adjusts. The infusion chart below immediately updates to the correct dose and the correct corresponding mLs per hour to set the IV pump. The physician ordered the infusion to be started at a rate of 0.1 mics per kilo per minute. If you click on the 0.1 mic per kilo per minute dose, it changes the row to yellow for easy identification. The corresponding mLs per hour is listed to the right. This is what you set your IV pump to. How many calculations would that have required otherwise? Again, eBroselow just took the math out of medicine. It just prevented some complex and error-prone calculations. Unfortunately, the patient is not improving rapidly, so the physician elects to increase the dose to 0.11 mic per kilo per minute. Again, you just click on the 0.11 mic per kilo per minute dose, and immediately to the right is the correct mLs per hour for your IV pump. The infant is becoming hypotensive and requires a dopamine infusion. But due to her poor perfusion, the only IV access available is one umbilical artery line. She really needs to get the dopamine, but must continue to receive the alprostadil. Can you combine them? Fortunately, at the bottom of the virtual page, there is Y-site compatibility information. As listed here, dopamine is compatible with alprostadil, so you are able to administer both drugs at the same time. Consider how much time was just saved by not having to place a second IV or having to contact pharmacy or another reference source to determine if the two drugs could be administered together. The patient gradually improves and stabilizes while in your care. She is transferred to the PICU and makes a full recovery. And how did eBroselow help our infant? First, eBroselow took the complex math out of mixing the alprostadil infusion. The patient was in an emergent situation and did not have to wait for pharmacy to send the medication. The benefit is that treatment began immediately. eBroselow showed the nurse how to program the IV pump rates. The nurse did not have to mathematically calculate the correct mLs per hour for the IV pump when increasing or decreasing the dose. The benefit is that potential errors were reduced. And thirdly, the patient required a dopamine infusion, but a second IV line was not available. eBroselow quickly showed that dopamine is Y-site compatible with alprostadil, so the nurse did not lose time by starting a second IV line.
These are just a few scenarios to demonstrate how eBroselow is improving patient safety and taking the math out of medicine. Thank you for taking the time to watch this video, and we look forward to working with you.